and I'm the founder and CEO of 4D Healthware. The problem that we're solving, raise your hand if you know someone that's overweight, diabetic, hypertensive. Everyone in this room knows someone because more than half of all adults suffer from those different illnesses. More than 25% suffer from 2 or more. And the thing about it, providers, not enough of them to take care of all of those people. Medicare recognized that and came out with a CPT code, about $40 per patient per month for managing individuals with 2 or more chronic diseases. Providers don't have the tools to manage them. Here comes our company. We're 4D Healthware. What do? We have developed a device-agnostic platform. That means that if you have a Fitbit, Jawbone, Misfit, any fit, doesn't matter. If you have a Bluetooth-enabled blood pressure cuff, a glucometer, and a wireless scale, we can begin to manage you on our platform. But it's not just about the sensors and the devices. We use artificial intelligence and machine-to-machine learning. That means that every time we pick up a piece of data from one of your devices, and that's about every 10 seconds, we're putting that into an intelligent algorithm and analyzing it to make a customized, personalized recommendation back to you as an individual. So it's no longer about eat right, exercise, get more sleep, drink more water. No. Specifically, what do you need to do today in order to self-manage your health? How does all of this work? Well, we pulled together an automated way from end to end that manages this process for every provider. We onboard patients electronically. They can be onboarded through their smartphone, through their tablet. They can be onboarded while they're sitting with the physician. Once that happens, they're connected to the 4D platform. What does that mean? If they have a smartphone, they download an app. If they happen to have one of those sensors, like I mentioned, it's a drag and drop to connect it to our platform. And within 30 minutes, we've done enough analysis of the data to provide the first recommendation. Anybody can tell me how many steps you're supposed to walk per day to be healthy? Anybody? How many? 10,000 steps. Bad answer. Today, I'm supposed to walk 14,579. And everyone in this room should have a different number. You know why? Because everyone in this room has a different situation. Some people need to gain weight. Wish I was one of those. Some people need to lose weight. Some people may have an illness or a condition that prevents them from exercising a certain amount. All of that needs to be taken into consideration, and that's what we do on our platform. Not only do we do that, we give instruction on, have you taken your medication today? Because you need to know and understand not just if someone has taken it, what if they haven't taken it? Why haven't they taken it? Is it because they're experiencing a certain side effect? If so, how do we communicate back to the physician that a modification needs to be made? Finally, that 20 minutes of non-face-to-face time. That's the tricky part, right? Most organizations have pens, paper, spreadsheets, and a bunch of people sitting behind the desk using telephones to check in with people to see how well they are doing or not doing. Our software platform does all of that for them. We send text messages, emails, notifications on the platform. If an individual is not responding to those recommendations on that type of technology, we engage with video medicine, e-fitness coaches, e-lifestyle coaches, and e-therapists. Maybe you're overweight and depressed, so you need additional assistance. We provide all of that assistance through 4D Healthware. And if the individual still is not responding, by exception, we will pick up the phone and engage with them and make an attempt to get them back on track. Once we keep track of that 20 minutes of non-face-to-face time, by the way, we don't care if it's 20 minutes, if it's 20 hours, it doesn't matter to us because the software is going to be doing the majority of the work. We submit an electronic bill to Medicare. Medicare reimburses the organization, and then we invoice the provider and receive our money. Our business model, 32 million people fit into this chronic care management, and that's just Medicare. 32 million people, $40 per patient per month, a $16 billion market opportunity. I'm going to say that one more time. A $16 billion market opportunity, and it's July. Most of that money has gone unclaimed. And the reason it's going unclaimed is because solutions like ours need to have a firm space in the marketplace so that providers know that we're here and we can do it now and we can get the revenue inside of 30 days. Our business model, in 6 months, we have 9,000 users onboarded. We are cash flow positive. In 24 months, 2 years, we have a target of 280,000 users onboarded. And that adds up to $5.6 million in revenue per month. This is our traction and pipeline. We signed our first deal in April. Remember, this is all new. Came out in January. We signed our first deal in April. We have a pretty strong pipeline now with deals at various stages of closing. My team, the Chicago-based team, is here today in the front row and will be over there by the banner. I'm an individual whose background is IBM Smarter Planet Systems, artificial intelligence, and machine-to-machine communications globally. I've designed smart systems, and I've implemented one in the healthcare space. That's all of my time, but we will be here, and we will be by the poster, and we're looking forward to speaking to individuals in this room. Thank you so much, and have a great evening.